Welcome to the Curitics Connect podcast, brought to you by Curitics Health. This podcast is your go-to listen for insights into value-based care, healthcare technology, and the innovations driving better patient outcomes. Each episode will break down complex industry challenges, highlight emerging trends, and speak with experts leading the shift towards the next generation of value-based care delivery programs.
Hello, everyone. Welcome back to Curitics Health podcast, Curitics Connects, where we like to explore the future of healthcare innovation, one conversation at a time. I'm Danielle.
Hi, guys. I'm Ryan. And today's episode is packed with insights on and how AI is moving from a buzzword to the bedside and even furthermore into our applications today, including those that are often left behind.
So, guys, we prepped you the last week about who we would have joining us today. So we do. We have Unmesh Srivastava. He's a strategic advisor here at Curitics Health. Unmesh has been at the forefront of value-based care technology solutions for well over 15 years and has really played a pivotal role in shaping how technology can enhance clinical decision support.
Yeah, Umesh, welcome to the show. We're happy to have you. Hoping that we will take it a little easy on you, but probably give you some hard ones along the way as well.
Yeah.
Sounds good, guys. Very, very happy to be on the podcast and excited for the conversation.
Awesome. Well, we're glad to have you and thank you. Thanks for joining us. So we have a couple of different segments, Unmesh. So where we're going to start is we'd love to kind of understand your journey a little bit, knowing your background and the amount of time that you've really spent at some major technology companies as well as healthcare organizations. Would you mind just kind of walking us and the listeners through a little bit of your background, where you started and how you got to where you are today?
Absolutely. Well, I born and raised in India. I did all my formation years were in India. So I went to school in India, did my undergrad from Rajasthan University, pursued electronics and communication engineering. Wanted to go for higher studies, so came over to United States in 2008 to Cal State Northridge to pursue engineering management. I always had the vision that I want to build something bigger and hence decided to go into management. But also I knew that I want to do technical management. So that's why I chose engineering management. So I came here, did my master's, worked for 2 years in consulting, where I consulted with a bunch of large organizations, Verizon, Toyota, bunch of others. Got really burnt out traveling on airplanes, and I wanted to get a sabbatical job, right? Like something where I can chill out for 6 months and not do the crazy traveling, and then get back into consulting. So that's what I did. I was living in Pasadena. Kaiser was 2 blocks away from where I lived, and who knew? I thought that U.S. healthcare is nothing is broken, was my assumption going in. So that'll be a pretty chilled out job. I land in Kaiser as a solution consultant, work in their innovation and solution design team. Within the first 6 months, I realized, oh my God, like there's so much that needs to be fixed in healthcare, and technology for the next 40, 50 years is going to play a very pivotal role in that. So I started working at Kaiser, did a bunch of things at Kaiser between their health plans, medical group, pharmacy, labs, hospitals. I worked in various different areas. It got me a good feel of healthcare, but anyone who knows Kaiser is one of the best health systems in the country. They are totally interconnected on Epic. And I, at that point, said, hey, now I know the career track I want to be in. I want to be in healthcare tech. But I want to really go into the tranches of what the life looks like outside Kaiser. So I joined a managed care organization. I had no idea what managed care was at the time I was getting in, because I saw the Kaiser world where everything is connected, everyone is employed. But I get into this North American medical management, and Prime Care was the medical group. At the time, we were servicing around 60,000 senior lives or senior members through our provider groups. And the bubble was further broken once I joined this organization. There was so much to be done. Medicare, Advantage, Medicaid. I got a first, feel of it that there's so much to be done. Or, the providers are burnt out. How do you support them with tech? Um, After joining NAM, I started building the innovation team there where we were building risk adjustment, quality, care management, utilization management, all the areas which impact patient care, provider experience, healthcare cost, quality of care. I was basically the quadruple goal. I was working on fixing them. Within my first few months of joining, we went into an acquisition and we became part of Optum Care. At the time, it was called Optum Health Collaborative Care. I ended up spending 8 years at Optum, built a lot of solutions, was involved in M&A, was involved in post-M&A integration, built a platform called Argon with my team, which was pretty widely used. After that, it was a great learning at Optum, but then I wanted to go back to the roots again, go back to startup land, join P3 Health Partners, where I met both you great people, right? We worked together there, and P3 was an awesome experience. I joined them as their first CTO, and we built the value-based care technology stack, which was servicing 100,000 members. That was a rapid growth. We took the company public in 21. We had some great co-founders, Sharif and Amir, learned a lot from them. After that, I obviously, over the years, I had spent so much money on big tools and technologies like Salesforce and others, which work, but they work at scale in big companies. And there was clearly a gap in terms of clinical workflow enablement, which is why, I called you and Chris, Danielle, and then, later on, Ryan joined the party and you guys started building Curitics. So, that was great to get that thing kicked off. And then post that, I joined Mayank Lee in the journey of Clever Care, where we built the plan from when I joined, we had around 1,500 to 2,000 members. We scaled it up to 30,000 members and scaled the operation up. And then most recently, a few months ago, I started Incuvio Health as a founder and managing partner, and very excited with all the things that we are doing and we will be doing. We don't want to build a short-term, build and flip organization. This is a long-term commitment that myself and the team is taking, and we are here for the long run. We'll build the right solutions. We'll build the right technology. We will bring in the right people. We won't bring consultants in. We will bring people in who've spent the time in the trenches, but also are executive level, who've taken that route up, and very excited with all the great things we're going to do with Incuvio. Sorry, that was a pretty long introduction.
It's a little too long, but I'll let you slide. You took away all my questions. I was going to ask you, what brought you to Curitics? And I know you alluded to it already in terms of some of the challenges that you saw, especially during your time at Kaiser, and I'm sure at Optum too. I spent some time there myself in those larger organizations. In terms of where you see the value-based care going, and also just Curitics and Incuvio, where they stand in the space, what brings you the passion to do that on a day-to-day basis, and also obviously your day-to-day, your regular job. I think your passion is palpable, and I think that it would really help our listeners to know why you do what you do.
I think anyone who works in U.S. healthcare, there's always a reason in terms of the why. Most of us have gone through life, have been caregivers, seen mortality, have seen how broken the system is, to really take this upon us in whatever way, shape, or form. So I think that's what keeps me going. This is a very personal story. I was still at United and Optum when my dad was diagnosed with cancer, and I flew back to India. I was his primary caregiver for 7 to 8 months until he passed away. But you know what that opened up? There was no hospital in the world that I did not call to identify what therapies, what treatments are out there. And it's so surprising that it's so hard to get hold of the right people in the right places. The information and the price transparency was a problem. But you know, that 7 to 8 month journey sort of taught me what it truly means. I mean, I've been involved in healthcare way before that, but during that 6 to 8 months, it sort of made me fearless in a sense where, hey, you know, when you're in big companies, you are involved with big missions and huge impact. But I'd rather go in smaller settings, but have a deeper impact on a smaller population. I think that's when I kind of moved away from the corporate and wanted to be involved in smaller organizations and startups and high scaling companies because their geographical scope is smaller. They are becoming big. But at the same time, you can have a higher impact. So I think that's what keeps me. Anyone who is in the startup land, and both of you know it, like no day is the same. It's always peaks and valleys. But that's the fun of it, right? I'd rather do this than be sitting in an executive office, a corner office with the glasses and looking at the nice view outside. I just can't do that. So that's
We,
what
we all
keeps me
share
going.
that sentiment, my friend.
We do.
Well, thank you for
I
that
think
story.
is, oh, go ahead. Sorry about
No,
that,
no,
Ryan.
you go
I was
ahead.
just going to add to that. I think it's funny that our stories are parallel in Mesh when we talk about, you know, how is it that we got into this space outside of just education and background and our professional lives, but it was that personal experience with dealing with an aging parent that has been diagnosed with a condition that puts them in a situation where you start to become their caregiver, the individual that helps facilitate the care coordination. You watch them struggle through all of the different challenges that we have in healthcare. And it really makes you start to see there has to be a better way, right? And I think that changes almost your brain chemistry in a way that's like, hey, I want to do something different. I want to be a part of something that's actually making a change for individuals. And you get away from just the business professional component and it comes back to the human center. And when I think which drives all of us and why we can all say that we've partnered over the years to be a part of not only Curitics, but as you've built out Incuvio and different organizations that we've been a part of. So I appreciate not only the background, but kind of giving us some insight into what's driven you to this space, which kind of leads me to my next question for you. And I think as somebody that has been at the helm of a lot of innovation and organizations that are building that technology, I would love to kind of get some insight from you as to where you see the whole human AI partnership going in the future. I mean, that's the talking points. Everybody's talking generative AI now, right? All companies are saying we have that. Do you see that AI can continue to be complementary to technology rather than just replacing it? Is it something as we go into the future that you believe that we can start to build trust around AI tools and technology? What are your thoughts there?
So I really think that people and AI go hand in hand. If you leave aside the big, you know, large scale transformation and all that big talk, you just take our day to day lives, how AI has changed it. When I write emails, there's an automatic embedding of Grammarly. Now it fixes the grammar. That's AI. You know, your day to day Google search that you would Google and spend 10, 15, 20 minutes on, now you can get in 20 seconds those answers. Use ChatGPT, Claude. It, you know, gave us back 18 minutes from searching and scavenging for information. I go to meetings. There's Otter AI, which is a tool now, which is attached to Teams and other tools, which just takes notes automatically and sends you a summary and looks pretty good. Now you don't have to chase someone to take notes or take notes yourself in the meeting. So if you take our day-to-day lives, AI is changing a lot of that. AI is just making our systems and workflows smarter. We will still have our workflows which will be driven by people. That's how I see it. So with AI coming into the picture, let's say generative AI, it was great. I was seeing a demo that Chris was producing the other day regarding, was the CTO at Curitics, and he was showing us generative AI care plan builder, right? You and I have worked in healthcare for so long and have done care management and have seen care managers spend 45 minutes to an hour generating a care plan. They have to look at the historical data, they have to look at health risk assessments, they have to look at annual wellness visit, chart notes, and then they come up with a care plan while talking to the patient. It takes them anywhere from an hour to hour and 20 minutes to generate the right polychronic care management care plan. Now with generative AI, build a Claude or a OpenAI wrapper, which goes and scavenges through all the historical clinical notes, documents, and auto creates the care plan, which is still like generation one care plan. You still have to have the care manager go in and fix it, but this has given them a starting point. So what used to take an hour 20 minutes is more like 10 minutes now because you've got an AI generated care plan which can be fixed, personalized by the care manager. So going back to your question, I think AI will help humans be spending time on things and areas that are more critical versus administrative tasks. And in healthcare, you've seen how much money do we spend on healthcare? 3.8, $3.9 trillion. I mean, it's bigger than GDP of,
A lot of countries.
Fourth country, that's the size of their GDP. So we are spending that money on healthcare, and a lot of that goes back to the administrative burden in healthcare, which I think will be removed by the onset of AI and the using of AI within the workflows.
One of our partner, Chris, he called it the great accelerator, which I thought was such a great idea, a great just like concept, in terms of like what you're alluding to earlier. All of those things are accelerators, right? They're accelerators in the market, accelerators in the industry, and with care plans specifically, being able to accelerate the creation of it and then allow for the individualization, it's the same thing. So it definitely, there's some synergies there within the market.
For sure. For sure. That was great. Well, if you don't mind, guys, we're going to take a quick break. We'll be right back and we'll go into some other chat points. Right. Welcome back. So we're going to jump into our next segment here, and we really kind of want to talk about patient engagement and what patient engagement tech is, and is it working?
Right. Absolutely. So, Umesh, I know you've done some critical background on this, and it's a bit of a pet project for yourself in terms of patient engagement. Same for me, just coming from the clinical background and how tech can enable that. I'd like to hear some of the stories or some of the anecdotal items that you've learned in your time with Curitics and Incuvio so far around patient engagement and how those two companies and the tools that we've used in both of those spaces so far have been able to accelerate patient engagement and really bring it home in terms of being able to be more, I guess, robust in terms of how it is today. Because it's been a challenge for a lot of the industry and a lot of the vendors out there and a lot of the companies in terms of engagement. So I'd love to hear your feedback there.
Yeah, well, that's a great topic, and I don't think patient engagement can be completely solved with technology, right? If you look a decade back, everyone's answer was you go build a mobile app. 10 years before that, it was patient portal. Before that, it was call centers. But if you still see the patient engagement rate in a lot of organizations, it's a lot of the pop health organizations I've worked with, it's 25%, 30% at an average. The good ones can scale it up to 35%, but that's about it. So definitely this is a very deep question, right? How do you solve for it? If I knew or others knew, then the, those rates wouldn't have been this low, right? But I can just give you my 2 cents on what I think should be done. There are also there's some organizations who do really well at patient engagement. Um, I think personalization is going to play a very critical role. And when I say personalization, um, not just focused on clinical conditions, but also brings into mind, the social determinants, brings into mind cultural nuances, ethnicities, languages spoken. So I think it's a culmination of all of that, where you truly meet the patients or members where they're at. A few minutes ago, we were talking about how we were going through these personal journeys with our family members, parents, which brought us into healthcare. And the example that I was talking about, it's just hard to get a hold of people, authorities, of folks who can provide us the information, right? You need to call a call center, get the answers around basic things like where am I at with my prior auth or claims. And the human tendency is that if you're doing good, you will not go search for that information, right? If you're healthy, you are not going to a patient portal. You're not logging into certain apps. And when you truly need that information, a lot of times you need it right now. And that's just the way tech works today, is like everything you want is on your fingertips in your phone. So I just I feel like the answer to all of this is building an experience for the patients and their family members, which is more push versus pull. When I say pull, you go to a patient portal, you call up a customer service rep. Rather than that, if there was, hey, I have to get 3 screenings done. I don't know. I will not call someone to know that I need to get the screenings done. Can I get a push notification of some kind? That's where AI comes into play, right? You can automate a lot of outgoing notifications, but also keep in mind, if they're culturally sensitive, if they keep in mind the social determinants along with the clinical side, I think it will truly work, and it'll work well. Aside from that, it's a work in progress. Patient engagement, truly, no one has cracked the nut. It's a work in progress. I mean, we built a whole business with Clever Care Health Plan around language, culture, and building an insurance company that meets the patients where they're at, or members, right? And hence it scaled so quickly. Same thing with Curitics. As I look at your stack, the more, and I know you guys are spending time there, but the more you spend time around personalizing and keeping it more push focused, the better you can enable the clinicians and risk bearing organizations, whether they are payers or providers or MSOs, to really get this right.
I know that you have spearheaded, or how you have advised us, right, at Curitics, to say, when you come and look at what we're doing on our technology roadmap, there's always this focus where you come back and say, what are we doing for the patient, and what are we doing for the provider, and the overall experience from both sides? And that has helped us really be able to kind of think about, when we're building out these different workflows and programs within the tool, how are we actually bringing value to those, whether it be the end user, provider, care manager, patient, but always having in mind, you remind us, like, the patient at the end of the day, and how are we giving them information that provides value, right? Not just giving them something at a time that, like, oh, here's this update, here's that. How are we giving you value? And you brought up the point around cultural sensitivity. And I think that's been, for us, really transformative in how it is that when we're kind of building out care management programs and allowing for features within our tool, how do we make sure that we're thinking holistically about that patient and how they would like to see things? So I know for us, it's been really helpful to have your advisement around that stuff, so that we say, okay, when you have a care plan, we're not just giving you a care plan in English, right? If you were a Korean speaker, if you're going to be provided something that you need to look at and take education from or information, let's make sure it is in language. So some of those little key points have really helped us as we're, innovating and building out Curitics roadmap. So great
I
examples
was
of
able
that.
to advise and be of some value there. But
Yeah.
at the
Yes,
end of the
we
day,
appreciate.
business is business. I feel like if you add value, um, you build the right things for your users, have that obsession around driving, making sure you make your users' lives easier, the business will follow. Build a good product. Don't worry about building a good business. You will have a good business at all times. But at the end of the day, the technology, the workflows, the things, the customer service that you're building needs to support um, your users and improve their lives. That's why you build support organizations like Incuvio or Curitics or a bunch of others that are out there. I think that's a value that anyone can bring to their users.
All right. Well, let's move on. I'd love to kind of jump into what the future looks like, Mesh, and when we talk about innovation. I know Ryan has a couple of questions here.
Yeah. In terms of just switching gears, I want to give you some opportunity to hit us with your vision in terms of what the future looks like in healthcare, but specifically want to use this time to do some rapid fire questions and you could just hit us with just like your first feedback. You don't have to do any long drawn out answers or think too long about it. We just love to learn a little bit more about you through this. So the first one that I have is, what's one piece of healthcare technology you can't live without? And then what's one piece of technology that's not healthcare oriented that you can't live without?
I think healthcare technology, definitely telehealth. I use
That's a
that
good
quite
one.
often, especially for lower fidelity support. Non-healthcare, I truly feel Chat GPT these days is very handy. So
It
I'll
does. It does. Yes. We all have our favorite at this point, right? All right.
Yep. So,
Danielle,
Unmesh,
go ahead.
if you think back to your early career days, right, when you're just out of school, you've come over to the United States, is there one piece of advice that somebody gave you or a mentor that you worked with that kind of drove you to where you are today that you wouldn't mind sharing?
Yes, I'll give you two pieces of advice which I truly keep close to myself. One advice was from one of my mentors at Kaiser. His name is Nardo Manalotto. He told me this, I was 23 at the time. He's like, Unmesh, your ability to see the big picture at the 10,000 feet level of how things connect to each other, talk to each other, and work with each other. Your ability, the higher you can view the business and the workflows and the people and all things together, will solidify your leadership skills. But a lot of leaders are weak leaders when they don't have the ability to take the flight down to the 0 feet, fix things that are broken, and then go back again up at the 10,000 feet very quickly. So the quicker you can identify where things are blowing up and the faster flight you can take down, fix, and go back up, the better you will be as a leader. So I think that advice just stayed with me, to look at the big picture, but then don't shy away from getting into the deep. The other advice was with one of my mentors and also my advisor, Lee Hutchins, was that, when you're building big teams, your team members are like your family members. Not everyone is going to be very smart. Not everyone is going to be emotionally, very attached. Not everyone is going to be a rock star. But when you build teams, you need to look at them like your kids, and your family members. You have to take, as a leader, you need to take them along with you towards living life, towards the greater mission, and just know they're all different. So just like with your family members, you don't have preferential treatment towards someone who is a builder versus someone a supporter or someone who is, just going to be there for the team. Just make sure you lead your teams like you will lead your family, and I think that's it just changed my approach to it versus being very focused on just delivering.
Beautiful.
That's awesome. Great
Well,
advice.
yeah, I don't think we share the same families because there's a couple of mine I don't like, but we'll let it slide. I'm just kidding. All right, so I have a good one for you. This one's a little deeper. What's your why that keeps you motivated every day? Right, you do a lot. I see you, and sometimes I wonder, do you sleep? We talk a lot, and I know you're always doing so much. I'm just that is a question that I think it would be answered well in this forum, knowing all that you do.
Yeah. I think a few things. One is the immigrant hustle. You can't take that out. I came to this country with nothing, with probably $1,000 in my bank account, and admission for at a state university. So going through the hustle of moving up in the corporate, getting the immigration, like you are always standing in line and you are doing your best. So I just don't take things for granted. I work hard. I try to work harder than anyone else that I know, but also I do it empathetically. I also feel like doing it with a team of people to make it an enjoyable experience is a great thing. I enjoy my work thoroughly. For me, it has never been work-life balance because I feel like the stuff I'm doing is so critical for for me and the people around me. Like, you will always strike the balance. So even though you see me working hard, like it's just ingrained. And at the same time, I do spend time with my family, and um, I think that's critical. And the why is just having an impact. All of us who are in healthcare have a why. Otherwise, I mean, I'm a techie. You guys are techies. We can be in another industry, probably have less work to do and more money to make. But, you got to be a little cuckoo to be in healthcare. And I think we all are
Good way to say it.
be in healthcare.
Yeah. Well, I think anybody that has spent any time on a phone call with Unmesh, whether you've worked with him at an organization or just a touch base, you can agree to the fact that even though he works really hard, he's a family guy, because you're always going to see now, especially a little girl on his shoulder, who's going to be 1 year old soon, or his oldest daughter walking in to make sure he's eating with some food. So I think we can all attest to that. If you've spent any time with Mesh on the phone, you've seen the co-partners there step in from time to time.
I take that as a compliment. Work and life don't have to be separate.
That's
It is
right.
a compliment. It is. Well, Unmesh, it truly has been fascinating to have an opportunity to hear about your journey, your early days, and really what's brought you to this point in time in your life, not only personally, but professionally. I know that it's been a great honor for me to work beside you for many years at different organizations, but also as we've been building Curitics from the ground up, to have you as somebody that continues to come and be involved in our organization and help to ensure we're on the right path, right? We're thinking about things at that 10,000 foot level. But when we do get into some of our challenges, right, you can come down to that lower level with us and provide guidance that others at a executive leadership level sometimes can't do. So it's been an absolute privilege for me, I know personally. And Ryan, I won't speak for you, but I think you can say your last minute closing words while we have Unmesh here too.
Yeah, absolutely. Umesh, I mean, we've worked together for a long time. I consider you a mentor and a friend. So it's been a pleasure. Look forward to doing not just what we're doing now, but obviously the future. So thanks so much for joining us today. And if you have anything you want to share in terms of where folks can learn more about Curitics or Incuvio or LinkedIn, feel free to add that in here. But just want to say thank you again for joining us.
Thank you for having me. And just my last closing word to your listeners is, hey, don't worry. Anyone who's trying to get into healthcare, just know there's a lot of scope. A lot of things are broken, which gives you opportunity to fix and be there for the long run. And anyone who's looking to drive digital transformation, please reach out to me. We have our doors open with Incuvio Health, and reach out to Danielle, Chris, Ryan, and crew on Curitics. They're building one of the best value-based care workflow engines in the country. So thank you.
Thank you.
Thank you. We appreciate that.
Dream big.
All right,
Dream
guys.
big. I like that. I like that.
That's right. Dream big.
All right.
Done.
All right.
Awesome.
Well, thank you all for today, for joining us today on Curitics Connects. We'll be back next week with another conversation with another thought leader in this industry. All right. Till then, signing off.
Thanks everybody for listening. We'll talk to you guys next time.
To learn more about Curitics Health, please visit curiticshealth.com. This podcast is for educational purposes only and is provided with the understanding that it does not constitute medical, legal, or financial advice or services.